Greetings, friends and followers. This is Nurses Talking. I am Del Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. So today I'm pleased to welcome Panagiota Tsikala, out of Austria. She's international. She's worked in 4 European countries. She's currently completing a master's in healthcare management, and she's also doing a second master's in renal care. She's a fellow with ISQUA, which is the International Society for Quality in Healthcare. And she says one of her interests is patient safety and health professionals' well-being. She is an active member in European and international nursing associations. And she says most important to her is that she has a daughter who is 21 and a son who is 18. So welcome, Panagiota.
Thank you so much for inviting me here.
It is my absolute pleasure. It's my absolute pleasure. But what led you on this path to nursing?
Well, I personally wanted to be a lawyer. And so, like 25 years ago, it was this system in Greece where you had to have some exams and to pass these exams and with some grades to go to the university.
Mm-hmm.
I failed in one of the exams, so I could not pass to the law school, but I went to the nursing school. And this for me was really disappointing. I said to myself, oh, that's a disaster. Because I don't know, I thought like it was a failure. I never imagined myself like being a nurse or I don't know. But then I started there. The first 6 months, it was really a disaster because I had no idea what are they talking about here? What is this? But the second year, something happened. I don't know. And I felt like, yes, I was born to be that. And this feeling never changed.
Yeah.
It's every day, it's like a first day.
I get that.
It never gets old.
It doesn't get old. Yes.
No. And I'm really grateful because of failing to, to have good grades in the history. And yes, I think I was a nurse even before I was born.
I fully understand what you're telling me. I fully understand what you're telling me. It happens that way. And the funny thing is that somehow we try to escape it. You know, you wanted to be a lawyer. You didn't even think about being and somehow it just pulls you there. It just pulls you there. And then it clicks. And then it clicks. You have worked in several countries.
Yes.
What is it that you notice that's different as you work in different areas?
Well, the difference is especially the mindset of the people, the way they prioritize nursing, the way the people see nurses and what exactly we do in the hospital. I had a friend who said to me, you know, before meeting you, I thought that nurses were like waitresses or something. Okay, my blood pressure went to, I don't know, 300 or 400 or something. I said, okay, don't say that in front of me, but anyway. Yes, I think that making clear what the meaning of our job is, what we actually do, this will help even us and will attract more people to become nurses.
Yes, yes,
because
absolutely.
because let's say in the Mediterranean countries, uh, most of the patients, when the doctor comes in the room, oh, it's like, oh yes, doctor, yes, yes, yes. And the nurses are okay, they are there to do something.
Hmm.
In the north, it's kind of different. Now I'm in the middle, where it's probably in the middle also, or it goes a bit down. But yes, the mindset is a bit different. The law is different.
Hmm.
All now I talk about Europe. I mean, there are other things that I'm allowed to do in Ireland as a nurse, but some other things I'm not allowed to do in Austria
Yeah,
or or in Greece or in Cyprus. And
yeah,
this makes things really complicated
yes,
for
yes.
for us, because I think that for nurses it is a requirement for us to be able to work everywhere.
Yep, yep, yeah. You have just articulated one of the goals of this channel, because one of my big goals is to have the people we serve see us for who we are. In many, many places, people do not, they have no idea actually
Yes,
what a nurse is, what is required of us, what education we bring to the table or experience or anything
yes,
like that.
yes,
And one of the goals of this channel is to kind of this, uh, put to rest those misconceptions. And like you, I was very pleased that you put here that you had worked in 4 different European countries, because like you, I have worked in different countries, and you articulated some of the things that I found as well, is that what you can do in what your scope of practice in one country is very different from your scope of practice somewhere else.
yes. And I think this should change,
Yeah,
in my opinion. Of course, there are many challenges still
yeah,
in
yeah.
in nursing. There is also sometimes us nurses, we consider ourselves not exactly what we are. Like,
Mhm.
yes, we are there just to help. We are just the nurses, all these things. It's not like that.
It's not like that. Yes, we need to know our value.
Yes, and we are, I repeat this all the time, we are the biggest part in every healthcare system.
Yes.
Give me a country where the doctors are more than the nurses, or the directors or the managers are more in
Yeah.
numbers than the
Hmm.
nurses. There isn't.
There isn't. No, there isn't. You're
No.
absolutely right. There isn't.
And our observations, the way we treat our patients all day, the time we have to talk with the patient, we have some very, very important information. The patients, they do say something, but sometimes they don't think that something is important, and probably it is.
Yeah.
So having really qualified nurses, I think it's a great asset for every healthcare system.
Yes, it is. Yes, it is. It is. It is. And not to put a final point on it, but it is our as observations and assessments and evaluations and reporting skills that drive the care.
Exactly.
That's what
Course.
drives the care. So your particular interest is renal care.
Yes, it was my dream since I was a student in the university, because
Okay.
we had to do some practice
Mm-hmm.
for 3 months in a dialysis unit. So I was there with my good friend. We were studying together, and we went there, but we were not allowed to do anything in the unit. So what to do? What to do? I found a book. That book was written from patient, and he was writing there his experiences. I was really absorbed. I couldn't stop reading that book. And that day I said to myself, I'm going to be a dialysis nurse.
Okay. 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 And you just stuck with that area?
No, but of course it's not so easy, I mean, to find a job in
Right.
something like that. And then I went to Cyprus. I worked there in a private hospital where I learned many things. After some time, some of my colleagues said, "Oh, you can apply to the government hospital." So I applied, and I went there, and the matron, was called then matron of the hospital,
Mm-hmm.
said to me, "Okay," she said, "we were 6 nurses." She said, "You go to dialysis." She comes to me and says, "Dialysis." And so I'm there. I do this to myself. I said, no, no. I said, that's a dream. Oh, I was fascinated. I said, no, this is not happening. And yes, it happened. And I worked, I worked 22 years, I think 14 in dialysis. In Cyprus, after when I went to Ireland, I worked there also in a dialysis unit in the University Hospital Limerick, where it was really excellent. And now, the last 3 years, I work in the dialysis unit in the University Hospital Vienna, where all my colleagues, I'm really proud to say that all my colleagues, they pronounce my name correct. And even, Austria is a German-speaking country.
Mm-hmm.
And for me, it's a huge challenge with the language. But my manager and my colleagues, they are so supportive.
Okay. Okay.
And
Excellent.
so this is excellent. I think this is actually our superpower for us nurses,
Mm-hmm.
to be connected and have this teamwork. We can do excellent things.
We can do anything. We can do anything. Anything.
Mhm,
But as so you were talking about you being a dialysis nurse and you're pursuing a master's in renal care.
mhm. Yes.
With all this experience, what do you think you would like people to know about taking care of their kidneys? Because I think that for me is one of my pet peeves because we don't one part of our education process when we educate people in the community really don't identify for them the internal organs that they need to take care of, the way they take care of their nails and their hair and whatever.
Yes.
What would you like people to know about taking care of their kidneys?
Well, having a kidney disease in the beginning, it's very silent. It's very important to take care of our kidneys because when you reach the point when you have symptoms, it's already late.
It's already late.
Yes. And I think it's exactly what you said, like we take care of our hair and this and that and the other, but it's so close to us, our kidneys, if you think about it, it's some centimeters, but at the same time, they're so far away.
Mm-hmm.
And we don't really think about this. It's really important to take care of our kidneys. And I, I mean, every year to do a checkup to see about your creatinine,
Yeah,
about the GFR, all this. It's really important.
that lab work is critical.
Yes. And
Yeah.
of course, drink a lot of water and avoid salt. But yeah,
Yeah,
we all
that
know that, but we don't do it.
no, we don't. That we know we don't. And we don't because we can't see it. It's not, it's not in our
Yes.
line of sight. We can't see it. So we just
The, this is the most fascinating part for me in dialysis because when a patient is connected to the machine, you see, you are a person by yourself. You can go around just by yourself. But
Mhm.
a person who is connected to the machine, imagine now, the person is sitting there, the person can see their blood going through,
Yes.
and
Hmm.
this person is one with this
Hmm.
machine. The person
With this.
cannot move alone.
Yeah.
This for me, this was the most fascinating thing that I realized when I went in this dialysis unit on 2000, I don't remember exactly when. And the dialysis patients, according to the literacy also, they are usually difficult.
Mm-hmm.
But if you put yourself in their position, I mean, I think I would be really awful as a dialysis patient.
Yes, yes, me too.
Totally. And I know myself, I am not a good patient. So I really try to be a fellow traveler for my
Mm-hmm.
patients.
Mm-hmm. Yeah, yeah, yeah. I understand that. I totally agree with you in that. I would be a terrible patient, I think. I would be very difficult to deal with. I might try not to be, but I'd be very difficult to deal with. I know it. Just because you are, for so many times a week, week after week after week, you are confined to this machine for hours.
Yes, it's awful.
It would drive me nuts. Um, so you belong to these organizations. You talk about one of your interests is patient safety,
Mhm.
and
Yes.
you belong to the International Society for Quality in Healthcare. Um, how do you think we can improve the firstly patient safety? Because patient safety is a big thing, and quality overall.
Yes. Look, we used to talk about patient-centered care, but in my opinion, I think we need more human-centered healthcare systems. I believe that the patient is a part of the system,
Mm-hmm.
and the nurses, the healthcare professionals, they are also. We need to take care of everybody who belongs to that system.
Mm-hmm.
And this is the only way to, to have a better, let's say, if I can say that, better quality and better patient safety. Health,
Mm-hmm.
health literacy, it's a huge thing.
Yeah. Yeah.
And of course, we don't have the resources. I mean, sometimes we have to be six, but we are three or four. You don't have the time. You don't have, I mean, to
Mm-hmm.
take care of your patients. Mistakes happen, all these things. And that's why we, I don't know how to explain this now. We bought a new TV, we bought a new sofa, and we put all these nice new things in a very old building. Healthcare
Mm-hmm.
systems, they're really old, and we
Mm-hmm.
try to put in there something new. I think we should reconsider these healthcare systems, the way they work, the hierarchy, the role of the patient, the role of the doctors. What are the people who are the cleaning people, the people who clean the hospital, the nurse, this, there are so many people behind the scenes. And in my opinion, we should reconsider the healthcare systems.
Yeah.
And if you ask me, I work in Greece, let's say it's a poor country. Austria is not a poor country. But why nurses are having here the same problems like in Greece?
Mm-hmm, mm-hmm, mm-hmm. Yeah, yeah. And probably the same problems like we have here. Because we're experiencing a couple of things here. We're experiencing nurse nurse burnout. We're experiencing a lot of nurses leaving the bedside. We're
Yes,
experiencing a quote unquote shortage of nurses. And I'm presuming you're experiencing the same thing.
the same thing. But my other question is the problem that we don't have nurses, or we don't have nurses who don't want to work in the front line, but they prefer to do a different path?
Mm-hmm.
Because
Yeah.
if you ask me, nursing involves not, of course, the master, the bachelor, the knowledge, the everything, research. It also involves the patient.
Mm-hmm, 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 mm-hmm. And
Uh,
mhm.
and we should probably bridge this gap.
What advice would you give to someone? Because you came to nursing not wanting to be a nurse. So,
Yes,
what advice would you give to someone who wants to be a nurse? Who says, I want to be a nurse, Panyata?
yes, just be. Why not?
Just being. Okay.
Yeah,
That's a good
it's
one.
it is. Look, you can be a researcher, you can
Mhm.
be a scientist, you can take care of people, you can support the community,
Mhm.
you
Mhm.
can feel very proud because you are a part of this universe, and you can put a small thing there to improve the future, because the future does not belong to us.
Right.
And I'm not talking about to be a good-hearted and all these things. You don't need that. You need to be a professional. Because in the hospitals, you need to have the guidelines, you need to follow things that they must be like that. But on the other side, you cannot forget that in front of you is a human.
It's a human. Yeah. No, and not just a human in need.
Exactly. And this is why I don't get upset. I never get upset when a patient is a bit, grumpy, because we are not at the same level. The person is on the bed with fear, with pain, and I'm standing there with my uniform and giving some orders, some things. So we are not at the same level this exactly moment. So I don't actually put myself in that position to be upset with my patient. I just try to put myself there and have some understanding, because if it was the other way around, believe me, let's yes,
I know.
I'm awful. I'm complaining, always checking everything, and blah blah blah. Uh,
I know. I know. There's absolutely nothing like knowing ourselves, is there?
yes. So
So
yes, I
you
would advise to everybody to just go there and be a nurse. You can travel, you can go everywhere, you can work everywhere.
anywhere and everywhere.
And the thing that my son one night he was sick, so I brought him to the hospital where I work.
Mhm.
And so we went there, and the doctor says, I said, yes, doctor, I also work here. So everybody was there really trying to help us. And so my son said, wow, you have colleagues here, and they try everybody to help you. I said, yes, this is what happens in the hospital. So everywhere you will find the team, the
Yeah.
colleagues, where they will have the same problems as you, and you will have another family.
Yeah. Yeah. Indeed.
So go for
Indeed.
it.
Go for it. Go for it. Go for it.
Yes.
When I asked you that question, you said that you need professionalism.
Yeah.
Do you think that is the most important quality a nurse needs to have?
I don't think that this is the most important. I think that it's really complex
Mm.
to say. I I think that we need nurses who respect themselves, and they can respect the patient.
Hmm.
And yes, we need people who are professionals. You can't say you need, to love people and be good-hearted and all these things,
Mm.
because every one of us, for my mother, I am the most good-hearted person. For somebody who doesn't like me, I'm really, ah. So each one of
Yeah.
us, we have many sides. Uh, so it's not something, it's not a characteristic that you can give to somebody,
Yeah.
in my opinion, of course, yes.
Mhm.
So I believe that we need decent, honest people who would like to work with others. They can respect others, that we are not the same.
Yeah.
And this is actually fascinating if you think
Yeah. We're
about
not
that.
the same. But we don't have to be.
No, exactly. And this is really nice. And you know, we nurses, we have this, I don't know how to say that. You know, I saw many people dying, and I know it's something really sad, but can you imagine hearing the last words of a person?
Mm-hmm.
It's an honor for me. And I always give, let's say, 20 seconds to the person who just like this, because somebody is leaving from here, and I was there.
You were there.
I mean, I really appreciate that.
Yes, yes, yes. That's a big deal for me as well. That really is a big deal for me as well. Mhm. What do you do? We talk a lot these days about self-care. So what do you do to take care of you?
Well, I spend time with my parents when they come to visit here in Austria.
Mhm.
I spend time with my kids, even though they laugh at me all the time. You know, you have no idea, oh, what are you talking about again? Da, da. But anyway, I cook a lot. I like to cook.
Yeah.
And sometimes I exercise when I feel my legs, because sometimes I don't feel them. And the other thing that I do, because I love it, is that I'm learning new things about nursing. And once somebody told me, oh, you're going to be very tired with all these studies. And I said, no, this for me is my hobby. This
Mm-hmm.
makes me feel alive. I
Mm-hmm.
love that.
Mm-hmm.
And this is the only thing that I will give to my children when I die. They will have this from me. My books and my love to nursing and to humans.
Yes, 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 yes. And what you have put out there into the world. Because we put out a lot. We put out a lot. Sometimes we don't see it that way, but we put a lot into the world.
Yes.
Panagiota, thank you very, very much for this conversation. I so appreciate it. Is there any last
Thank
word
you.
you'd like to leave us with?
No, I just want to say that each one of us needs acceptance and understanding.
Yeah. Yeah.
And it's we find it always easier to say something negative.
Yes, indeed.
But you know, if you try every day to find something positive, to say something positive to the others around you, to our team in the hospital, this is amazing
Yeah.
and brings people closer and makes everybody to feel appreciated.
Yeah. 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 And you, as you said that, my mind went to, I will tell everyone or anyone that I am very, very bad at math. So it's going to be interesting now that I will make a mathematical reference. But as you said that, if we try to just say one good thing to our team, what occurred to me as you said that is that it is exponential. When you put one good thing out there, it broadens like that. And if everybody did that, just imagine what a day it would be.
Yes.
Indeed, indeed. Thank you so much, Panagiota. It's been a
Thank
great
you.
conversation. Thank you.
Thank you for having me.